State Department of Health. Mayor Jane Castor, and we are out here at Reverend Banks' church, St. John's Progressive Missionary Baptist, and we are providing 500 vaccinations for individuals that are 65 and older. And it is a cooperative effort, clearly from the church, from the community, from our first responders, the state, the county, Hillsborough County, and the city of Tampa, everyone coming together to do what we can to get these vaccinations administered as quickly as possible. So this is a wonderful day here, especially for some of our seniors who might be in those high-risk categories. So, Dr. Holt?
Thank you, Mayor.
We're going to jot that down real quick, Dr. Holt.
Thank you. Yeah. This is the beginning, and this is the right start. The governor has given us a challenge, the leadership of our county government, mayor, and the community. We're going to get this done. The vaccine is coming, but every dose that comes into this county will go out immediately. And it's not enough right now, but be patient. The most important thing we're doing is just what we're doing here today. Going to the places, the people who need it the most and have perhaps the least access. And I can't think of anything that's more important during this times. Thank y'all very much.
Can you speak to the importance of specifically getting black folks vaccinated, black folks vaccinated?
Yeah, absolutely. First off, we realize there's some questions and perhaps even some hesitancy. The most important thing is to inform and have leaders. We are blessed in this community, both our pastors are faith-based, but also there's a pharmacist, Dean Kevin Sneed, who has reached out a lot to give some good information. Examples like the mayor and others of going first. Our communities of color face a double challenge. They are at greater risk of becoming infected, and that has a lot to do with being essential workers, being out in the community, don't have a choice to work from home as much. And that's sad. That's the way things are in our community or our society, and we're all working to change that. And then the other thing, because that's called the social disparities, the other part of it is they're more vulnerable to more severe infections because they have what they call underlying conditions. And that's something public health we've been working on long before the coronavirus. So for those two reasons, it is essential that our communities of color be the first round. Thank you for the question.
Can you discuss I know you said this is 500 doses. Can you kind of discuss the plan, how many you receive, how often, and then kind of not just this community, but also, how you're going to choose other communities to roll this out in?
Sure. We've been developing, actually working on a distribution system. So the health department through the governor, I guess I receive the vaccine, and then we work with partners. The county and city have set up vaccination sites over the last week that have done almost 9,000, and we are scheduled to do the same. We're going to be targeted vaccination efforts. This is an example. We'll be also doing senior living facilities. We're engaging our medical communities because they have what I don't have enough of, which is the people that can vaccinate. So this is a partnership. Our community is stepping up like we knew, and Mayor talked about this, I recall, from the very beginning at the county, that we are blessed by our medical facilities, our people, and I think the community trusts us, and my job is to help others do the vaccination by giving them the vaccine.
Doctor, what does next week look like now moving forward? People still needing to sign up for an appointment and get I know last week it was shut down.
Yeah.
So what does next week look like?
Yeah, that was a challenging, we heard we originally were only planning to do a small, very small number. We got some partnership with Tampa General, and we got good news. So literally the weekend after New Year's Day, we went from planning of 1,500 to 9,000. That was our capability. But the call centers, and I think we all know, we're not up for that. The county has engaged a contractor who has experience in much higher volumes. So the plan, once we finalize how much vaccine we have, we'll be opening up appointments. I'm not sure if that's up to the county exactly when, and the contractor has to set it up, but it will be this week.
I mean, I know this is sort of a different group, but if you can speak to teachers as well, another concern is very concerned with restriction, and some teachers are saying to Tallahassee to sort of urge for them to be next to get the vaccine.
Yeah, we've been in touch with our superintendent, and again, I hope I can tell you more later this week, or certainly by next week, about some strategies that we're going to be putting together. Initially, we're limited to those teachers and staff that are over 65. That's just the way it's written in the governor's orders. So we're going to start with that, but we expect to rapidly expand. They are one of our essential critical workers plus 65, and we're doing that with other critical partners. To do the teachers, we'll take a joint effort from our medical community, and I've already received preliminary responses that they're on board with that. Vaccine supply still drives everything, so we've got a great distribution system, and our supply is limiting us a little bit, but no vaccine will be left if it comes in this county. We're getting it out.
And will this church remain a distribution site as you get vaccines, or how does that work?
Yeah, this is a complimentary program that the governor has initiated, and again, Mayor Castor was a big driver for this for our community. So I think what we're going to do is build on that locally, and how can we sustain that? I don't know if it'll be this particular church, but this is clearly a success, and we want to repeat that. We'll get what it takes to pull this off. Right now the state is doing the staff and the vaccine, but our plans will be to continue this effort within our local resources. So we're coming to a church near you as soon as we can.
Really quickly, just to go back to what you said, last week it was 9,000 vaccinations given out?
We had about 9, it was the exact number, and the county has that number. I don't want to, if you want, it was probably closer to 8,500 just from, but very close. We are capable of doing 9,000, and that's the standard that we want to continue. We're going to have to ramp that up if we continue to start doing 2 doses in several weeks. So we want to be given second doses and first doses. So we are capable. We're developing that capacity, and I'm confident that that vaccine will continue to come, because as a community, as a county, we're getting it out there.
You expect more this week?
We will. I don't know exactly the number yet. It will be enough to sustain our efforts that we had this last week with our drive-thrus, and I hope to find some others targeted efforts like this or others to build that partnership, because we got a good group of partners for our distribution. We want to give them what vaccine, because they can then sort of a slow opening, work out their kinks, and then as the vaccine comes in, the more and more we'll be able to give out.
individuals or maybe the pastor, you just speak to how the church was chosen, first church for something like this?
Thank you so much. I am Pastor Bartholomew Banks. I've been in this church for about 30 years.
Spell your first and last name for us.
Bartholomew Banks. I have a good working relationship with county government and city government after having been an employee for 38 years. Very familiar with the great work that Mayor Castor is doing. And so she was gracious enough to call and ask if our church would be a pilot site. And without hesitancy, I said yes, knowing the importance of getting the vaccine to our community. But in addition to that, being one of the first in line to demonstrate the willingness to put myself on the line as an example of the need for the vaccine being distributed in our community.
What was the conversation like? I'm pretty sure you got some that were hesitant, sort of speaking to those that were and convincing them that this is important and safe.
Well, I've heard the anecdotal surveys that there is some hesitancy in our communities, but I have access to medical professionals in our convention and in our church, and speaking with them, they indicated that the research indicated that the vaccines are safe. And so that is a message that I have been spreading to those constituents that I have influence on.
I want to make one more comment. I just want to talk about this, the question about the churches. This is something that, regardless of issues going on in anyone's life, you can get to church on Sunday morning. So what better location to be able to administer this vaccine, especially to those individuals that may be high risk. And so we will be looking at, because this has gone so successfully, looking at having it at other churches throughout our community, not just in the city and the county, hopefully all over the state. As Dr. Holt alluded to, we have the processes in place. As soon as we get the vaccine, that will be distributed. So I just want the public to know that they will have confidence in our ability to communicate consistently, clearly, and let them know exactly what the plans are and how quickly we can get this vaccine out. Just looking at everyone standing behind us shows how lucky we are to live in Hillsborough County and in the Tampa Bay area, because everyone comes together to ensure that we're taking care of the health and safety of our community. We have Reverend Banks, we have Dr. Holt from the Department of Health that runs it here. We have State Representative Diane Hart. We have our first responder Fire Chief Barbara Tripp. We have Orlando Goods, City Council member. So everyone coming together to show that this is how you can distribute this vaccine. And we've got a number of plans. It's not just the churches, looking at parks and recreation, looking at elderly facilities, looking at teachers, everything we can do to get individuals vaccinated as quickly as possible. All we need is the supply of the vaccine. Thank you.
Dr. Holt, for first name.
Doctor.
Councilman, I guess speaks to you being a part of making sure that happens. Just want to
I just have to turn and Mayor Castor, I have to turn to her and give her a thumbs up on the well effort to bring this to our community. I look at it as a day to save our community. I look at it as a day that we have all our elderly seniors, which I know most of them are here, and that's the catalyst of our community has always been our elderly folks. And with them coming out, giving that opportunity with their arm, to me that helps me get the message out to our younger people that the vaccine is fine. We need to get it to stop the spread in our communities. So I think that's the most important thing we can say, that our elderly community came out, and as you can see with 500 folks coming out here in the cold to get this vaccine, I think it's a wonderful thing, a wonderful day for today in the city of Tampa. And again, thank you, Mayor Castor and Pastor Banks, for allowing us to use your facility.
Thank you, guys. Thank you. Great job.